Kaya sa isinuak, ekipe mamsitik ni yaumaskikia. Kahkustikoma, ekwekia tuichikotik. Makekwa, wapskuya sotakatakohtit, taskina, mitsetaksona ekipetat. Ekwa nantao 1900s, ektaho ekimskawahtatsik, katsistahotskai sinuak, kawichikotsik, natokohe kakustatikoaki aksona, wawiso kawassak, maka ewichikotsiko haya, mitsetet o kapntistahotsik, pimatsikotsik, o tantaskina, kayas, o himaskikia, ekimiitsk nehiawak, minaya kehteyak, eki kotsiwaatihtsik, ekwa mootskwetsimitsk, anotsaya, atihtaisino akoke, moitapuakeihtamokoma katsistaotsk, mina awinoa katsistaokotsik. Maka, mitsetewitsikotsik, minewkam kapnchistaotsik, wawiso kawassak, moyaya kasikskakok, katsistauhkawin. Maka, kawichikokaya, tanse, te suichikotsiko katsistaotsik, wawiso kawassak. Eokuma skastipayitsikan, kamam skotaman awassako tsoman kapnchistaotsk. Uniki koma okoke, kakwetimatsik, maskikiuskoa apotatoskewa, kikwayan mote.
Vaccines. You might have gotten information about them at the health center, from a community health nurse or other healthcare providers. But you might also hear or read about vaccines through a word of mouth or on the internet and social media, like Facebook or Instagram. With so much information available online, it might be difficult to know what to trust and what could be misleading or incorrect information. As an expectant parent, you want the best for your child, and this is why finding trustworthy sources about vaccines is important. Beliefs and opinions about vaccines are different for different people. It is important to know who to ask about vaccines in order to get the correct information. Why are vaccines important? Vaccines have been around since the early 1900s and were developed to protect against dangerous diseases. Although most medicines are used to treat or cure diseases, vaccines are used to prevent children from getting sick with a disease in the first place. Because vaccines have been used successfully for decades, many diseases became uncommon. Although you might not hear about some dangerous childhood diseases anymore, children on Turtle Island can still get them if many are unvaccinated. For example, pertussis or whooping cough, which is a vaccine-preventable disease, can kill between 1 to 4 unvaccinated babies every year in Canada. This is why it is important to give your child all recommended vaccines to protect them and other children from serious diseases and prevent outbreaks in the community. Are vaccines safe? How are they approved? To be approved for use in Canada, all vaccines undergo testing to make sure that they are safe for use. After any vaccine is approved, Health Canada keeps collecting information on any serious side effects, such as the allergic reactions if they occur. You can speak with your community health nurse if you want to learn more about vaccines, get resources, or ask any questions before, during, or after the appointment.
What should I expect at my child's vaccine appointment?
When your child is 2 months old, you can bring them to the health center for their first vaccine visit. At the visit, your nurse will do a general health checkup and will share with you information and resources on vaccines. At every vaccine visit, your nurse will ensure you or the guardian of your child has given informed consent to your child receiving vaccines and will check that your child is healthy and ready to be immunized. Your nurse will ask you to wait for 15 minutes after your child gets the vaccine to make sure there are no allergic reactions. In the very rare event that your child has an allergic reaction, your nurse is trained to administer medications to manage the situation and make sure your child is safe. At the end of your child's vaccine visit, your nurse will assist you in booking the next visit. Every vaccine visit is an opportunity for you and your family to ask any questions about your child's health. Nurses at the health center are also available to support you in vaccine decision-making for your child at any time. What happens after my child gets the vaccine? Our body's defense system, also called immunity, learns from previous infections to fight and protect us from the same infections in the future. Vaccines do the same by making our immunity stronger towards a specific disease without us having to get that disease. Once your child gets the recommended vaccines, this will help their natural immunity be ready to fight infections. Some immunization visits, your child may receive more than one vaccine. Getting multiple childhood vaccines at the same time does not overwhelm your child's immunity. Your child sees many more germs every day than they ever receive in a vaccine. Like any medication, vaccines also could cause mild side effects. A child may experience short-term side effects, such as redness, swelling, pain at the place the needle goes in, or fever for a short while after the vaccine is given. The side effects typically go away within a few hours to a couple of days. Why do vaccines cause side effects? This is the body's natural response to building stronger immunity and fighting off infections. At your child's vaccine visit, your nurse will provide you with information about ways to manage the side effects of vaccines if they occur. You can apply a cool cloth to the injection site, give your child fluids to drink, or fever and pain-reducing medications. For further information on vaccine side effects and how to manage these symptoms in your child, you can connect with your local community health nurses at the health center who are equipped to answer your questions and concerns. Here is a list of community and provincial resources about vaccines and your child's health.